Hi, everyone. My name is Dan Toner. I'm the health insurance agent for PavXpress. Um, Going over a recorded video to go over a 20-page document as briefly as I can. This is our annual kit that we've put together. As you guys may know, the health plan renews every February. This year, we are going to make some changes. We are moving from Oxford, who's a United Healthcare company, to Aetna. And there's a couple of reasons we're doing that. Number one, the Aetna network is larger. Some of you have voiced some concerns about the Liberty network with Oxford, with maybe not having some providers in there. So the Aetna network should be bigger. Two, some of you have voiced some service issues from United Healthcare in Oxford over the past year or two. So we think the service should improve by going to Aetna. And there's a third reason. Oxford raised rates 10%. So that would cost your rates to go up, Pav's rates to go up, and Aetna allowed us to basically keep our costs the same as last year. So there's three fundamental reasons why Christian and I got together and management and decided, you know what, let's give Aetna a try. So on February 1, we are changing to Aetna. Within the memo, you can see we're going to offer three different plans. These are roughly the same plans. We always wanted plan one, like a base plan, to be the lowest cost possible for those that don't go to the doctor that much. Plans 2 and 3 are pretty identical to the plans that we have now, with the additional benefits of lower out-of-pockets. So, by the way, there's even a fourth reason to go to Aetna. It's the out-of-pockets are less for people. The costs, I'm going to just skip back and forth to these 2 pages. Everyone's going to be getting a medical selection sheet this week. We would like to wrap up open enrollment on Friday the 17th. I need to let Aetna know by Monday the 20th who wants each plan, who's waiving, and then they'll take about a week to enroll everybody. That'll give us ID numbers and ID cards before the end of the month for a smooth transition. Everyone's going to get a selection sheet to basically write your name in and decide, are you going on plan 1, 2, or 3? And at the bottom, you'll check off if you're a single, if you're adding you and a spouse, if you're adding you and children, one premium, no matter how many kids you have under the age of 26. And families are you, spouse, and children, again, as many children as you want under the age of 26. You pay one premium. So there are 4 ways to cover. You need a checkbox. Are you on this plan as a single? Check this one. Obviously, if you're a couple under this one, you would check this box. So you're telling us if you want plan 1, 2, or 3, or you're clicking here to decline. Okay. There's going to be more to the memo, which I'll go over in a second. So looking at the 3 different plans, what's important to know is when you go to your primary care, you'll have different copays for the 3 different plans. DW means deductible is waived. That means you simply pay the copay. When you go to a specialist, you will pay a copay for 2 out of the 3 plans. The first plan is a low-cost option because it gives you a copay to the primary. It gives you a copay for urgent care, and it gives you a $3 to a $10 copay for generic drugs. You then have a deductible for everything else. Specialist visits, name brand drugs, hospitals, surgeries, you would owe a deductible. So this is an excellent plan for someone who's pretty healthy, who really only anticipates getting their annual well visits, which are always free, going to your primary doctor. If you get sick and you can go to an urgent care center as opposed to the emergency room, you'll have that $100 copay. And if you're taking mostly generic drugs, you'll pay the copay of anywhere from 3 to 10. You would owe the deductible for everything else, but again, if you're healthy, you don't anticipate a lot of doctor care, this is a better plan for you in that what you're going to save out of your paycheck every week, every payroll, I should say. Options 2 are very similar to the United Healthcare plan in the doctor copays, the pharmacy copays. By the way, this is a $45 or a $75 copay for what's called Preferred name brand is a $45, and a non-preferred is a $75 copay, with generic being anywhere from $3 to $10. This plan has a $1,000 hospital surgery and imaging, like an MRI, CAT scan, or PET scan deductible. That is very similar to the Oxford plan, but you owe 20% afterwards. The Oxford plan was 40%, so this is a richer plan. And the out-of-pocket was a lot higher. With Aetna, it's $5,000. So what that means is if you have hospitals, surgeries, or imaging, you owe $1,000 plus 20%, but you can't spend more than $5,000 no matter what happens to you. That's called your maximum out-of-pocket. And if you happen to hit that number, everything is paid for free. You don't even owe a doctor copay or a pharmacy copay. Literally $5,000 is the most you would spend. So again, this is a similar but actually a richer plan to our current Oxford plan. The last plan is called the Premier 3000. The doctor copays are lower. The specialist copays are lower. The $3,000 deductible is for hospital and surgery. With United and Oxford, emergency room and imaging are part of that deductible. So here with Aetna, it's only your hospitalization and your outpatient surgery where you would owe this $3,000 deductible. And then you could see the coinsurance is you owe nothing. So very simply stated, if you're in the hospital for 30 days or 60 days or 90 days, you literally owe $3,000 and then nothing. What makes this different from Oxford is emergency room services are a copay of $500. The deductible is waived. The deductible is not waived with Oxford. And with imaging, there's a $250 copay. The deductible is waived. That's not the case with Oxford. So again, this is a significantly richer plan. And at the bottom, you'll see a little bit lower copays for name brand drugs. So that's fundamentally the reason we are going with Aetna. So again, we need your selections pretty quickly. I've gotten a flyer here on how to look up your doctors. If this helps you, we are looking at what's called the Aetna Choice POS. This is their largest network in the country. It's nationwide. I can go to New York, Pennsylvania, Texas, Delaware, Connecticut, obviously New Jersey. That's how you look up your doctors. I've also given some a lot of collateral material like marketing on their websites, how to look up and make appointments. They have a deal with, they are owned by CVS. So you can go to CVS, their Minute Clinic, for $0 copays for costs. So I've given you some information from Aetna. They give deductible credit. So if anybody met their deductible with Oxford in January, they'll accept deductible credit. So don't worry about the change on February 1. They give credit in case anybody had a hospital or surgery deductible they would have owed with Oxford. They have an EAP, an employee assistance program included. This is some information about that. They offer a variety. There's the Minute Clinic. There's they have virtual care, telemedicine, mental, nervous, and programs, maternity programs, extra help with diabetic care, wellness, fitness and wellness programs, and just a series of discount programs because you're an Aetna member. So I've given as much information as I can about Aetna. So coming back to my memo on page 5 that's me, Dan Toner. My staff, Amanda and Leslie, helped me. That is Aetna's website and their call center. You'll get that on your ID card, which will probably come a few days after we do the submission. And that's it. So if you have any questions, feel free to contact me. Have a great day.